Doctors have a secret anemia clue they use to determine if you are deficient in iron, and it's not what you think. In today's video, we're going to uncover that hidden clue. I'm an NTX surgeon and sleep medicine doctor, and today we're talking about young and tired. Do you feel like you're always exhausted no matter how much sleep you get? Are you constantly feeling drained and lacking energy? If you're nodding your head thinking that describes you, then this video is for you. It's important to know that there could be underlying medical conditions contributing to your fatigue. One such condition is iron-deficiency anemia, a common type of anemia where the body doesn't have enough iron to produce healthy red blood cells. Now, you might be thinking, okay, so I'm a little tired and my doctor already told me it's because I am anemic and low in iron, so he or she prescribed me iron pills. But did you know that there is a specific finding on physical exam that doctors use to determine if you really are low in iron? Let's talk about it. There are many symptoms associated with iron-deficiency anemia, including pallor, shortness of breath, weakness, dizziness, cold hands and feet, headaches, brittle nails, and frequent fatigue. But the most telltale sign isn't any of those. It's something completely different. One thing you should know about red blood cells is that they contain hemoglobin. When someone is anemic, their blood has fewer red blood cells than normal, and this means that their tissues and organs don't get enough oxygen. This can lead to the symptoms we mentioned earlier, like fatigue and shortness of breath. But there is a very specific physical finding that doctors use to diagnose iron-deficiency anemia. You see, the color of our skin is determined by the amount of oxygen-rich red blood cells that flow through the capillaries close to the surface of the skin. When we don't have enough iron, the body produces fewer red blood cells, which makes the skin look paler than normal. However, there is one part of the body that tends to hold on to its color even when we develop anemia, and that's the conjunctiva of the eyes. The conjunctiva is the clear layer of skin that covers the white part of the eye. When doctors examine the conjunctiva of a patient with iron-deficiency anemia, they may notice that it has a pale or slightly yellowish tint to it. So let me ask you a question. Take a good look at your own conjunctiva right now and try to determine if it has a pale or yellowish tint to it. I know you probably can't do it while looking into a mirror, but take a good look at yourself the next time you walk past a window or get a photo taken on your phone. Once you look closely, you'll start to see tiny shades of yellow in the whites of your eyes. And if you are low in iron, it will be more pronounced. What does this mean? Well, the reason why the conjunctiva is affected in this way is because it has a high concentration of hemoglobin. It turns out that the conjunctiva is one of the last places in the body to release iron before it becomes deficient. And in fact, doctors have found that the color of the conjunctiva is a very good indicator of how much iron is stored in the body. But here's the kicker. Just because you have a pale conjunctiva doesn't necessarily mean you have iron-deficiency anemia. And just because you have a healthy-looking conjunctiva doesn't mean you're not anemic. You see, while the conjunctiva is often the first place to show signs of iron deficiency, other factors can also affect its color, such as inflammation, allergies, dry eyes, certain medications, and liver disease. Similarly, even with iron-deficiency anemia, the conjunctiva may not always be pale. That's why doctors use the conjunctiva as a screening tool along with other clinical findings and laboratory tests to diagnose iron-deficiency anemia. If you want to learn about what those laboratory tests are, check out this video. Now, some of you might be wondering, great, I checked my conjunctiva and it looks a little pale. What do I do now? First things first, don't panic. A pale conjunctiva is just one possible indicator of iron-deficiency anemia. It's not a diagnosis in itself. The best thing to do is to schedule a visit with your primary care doctor so they can perform a comprehensive physical examination and run some blood tests to check for anemia. If they do find that you have iron-deficiency anemia, your doctor may recommend making changes to your diet to increase your intake of iron-rich foods. These include red meat, poultry, fish, beans, lentils, tofu, spinach, and fortified cereals. In addition to dietary changes, your doctor may also recommend taking iron supplements. However, it's important to note that not all types of anemia respond to iron supplementation. For example, vitamin B12 deficiency anemia and folate deficiency anemia require different treatments. Also, you may be surprised to know that there are actually many different causes of anemia, including chronic diseases like kidney disease, autoimmune disorders, certain medications, and genetic conditions. So it's important to work with your doctor to identify the underlying cause of your anemia so that they can recommend the most appropriate treatment. And here's another interesting point. In some cases of iron deficiency anemia, your body may not be absorbing enough iron from the foods you eat. This condition, called iron malabsorption, can be caused by various factors, including a lack of stomach acid, digestive problems like inflammatory bowel disease or celiac disease, or even having had gastric bypass surgery. If you suspect you might be experiencing iron malabsorption, it's important to talk to your doctor about it. They may recommend additional testing to determine the underlying cause and discuss treatment options with you. We hope you enjoyed learning about this lesser-known aspect of iron deficiency anemia. Did you know that the color of your conjunctiva could be an indicator of your iron levels? Let us know in the comments below if you found this information helpful. We value your feedback and are always looking for ways to improve our videos. If you've been enjoying our content, please don't forget to hit the subscribe button so you never miss out on our latest videos. Thank you for watching and stay healthy, my friends.